Hi, Dr. Applin here. Today's blog post is on battling the effects of arthritis. And I think first and most important point is really trying to understand what arthritis is. And today we're specifically addressing osteoarthritis. There's several different types of arthritis, but osteoarthritis is typically the one you see with normal wear and tear over the course of a lifetime. So usually arthritic changes are the result of repetitive stress. Repetitive stress simply means doing one activity over and over and over again. And if you do that activity too much, it puts a lot of stress on the joints in question and they start to literally wear down or break down. The other way to develop arthritic changes is to have a trauma, some sort of significant trauma. And oftentimes what we see is this trauma happens very early on in life. You know, we'll have a patient come in who's in their 60s and has shoulder arthritis on the right side, and when we question them, they had a significant injury to that shoulder maybe when they're in high school or maybe when they're in their early 20s. It doesn't always manifest itself right away. It can take several years and even decades to fully develop. And at its core, arthritic changes are essentially the result of instability in a joint. And instability could be from tight muscles, it could be from weak muscles, it could be from, like we described earlier, injury to the joint. And one of your body's ways of trying to actually stabilize that joint is by laying down extra pieces of bone. It, in fact, actually tries to fuse that joint together because it really doesn't know any other way to try and improve the stability of the joint on its own. So if you think of that over the course of months and years, those extra pieces of bone that it's laying down, they create what we call little bone spurs, and which are sharp little jagged edges around the joint, which they can push into the muscles, they can push into the nerves, can cause quite a bit of pain. Another thing it does is typically the spacing of the joint starts to significantly reduce. The fluid that's in the joint that's required for normal joint motion starts to reduce. And it doesn't matter which joint in the body this is. It could be the shoulder, it could be the knee, it could be the lower back, it could be in your neck. Basically, the process is the same, regardless of which joint it is. So when we talk about ways to help manage arthritic changes, really number one thing we want to do is try to stabilize that area, and we do that through specific physical therapy techniques, including massage, stretching, joint mobilization, and probably the most important point is specific rehabilitative exercises that will stabilize that joint enough that the body doesn't feel like it has to try to stabilize it for you. With these arthritic changes, we're not looking to actually get rid of them, and unfortunately once these arthritic changes have set in, you really can't reverse them. But what our goal is to either slow or completely prevent it from progressing any further than what it already has. And we do that through those techniques that I described earlier. A strong, healthy joint isn't going to progress as fast as a joint that's weak or unstable. And there are other ways you can help manage arthritic pain through dietary supplementation and everything, specifically supplements that encourage an anti-inflammatory effect. So go ahead and read through the article. I hope it is very informational, and we'll see you in a couple weeks. Thanks.